Yeah, definitely. We actually work with Gothenburg on that. We have actually a paper that we're coming up in Nature Communications about that when we try to apply it in AD. In the same court, the Norwegian court, that we work with the dementia disease initiation, and we find that if you take in plasma, if you take the p-tau we had 181 at that time, and combine it with the BD-tau as like an amyloid and neurodegeneration combination, we do see that the A amyloid p-tau positive and the BD-tau positive have a lot faster decline and higher atrophy rates than compared to the p-tau positive, BD-tau negative. So that's quite promising. I think it's quite interesting as a marker. But the most interesting thing about this marker, which is also coming out in a series of papers now, I think, is in stroke. It's very sensitive to cortical stroke. It correlates with the cortical the stroke size. Diameter quite nicely. The first time I saw the data, so this can't be right. But then he's replicated in different cohorts. So it seems to be very stroke relevant at least. But it also, I'm not sure. I'm looking at the data all the time for the BD-tau, and in plasma at least, it's very non-normally distributed. You have a lot of extreme values, and I don't know what the reason for those are. It might be brain barrier dysfunction, leakage. More tau coming into the bloodstream that we pick up with this assay in plasma. It might be something else that I don't really understand. But at least it's in our Nature Com paper, we actually show that it's not that associated with kidney dysfunction at least, which many of the p-taus, and especially neurofilament light chain, is a lot more. We also show that in the same paper. So yeah, it's an interesting marker, but so far, it adds something in AD, but I think maybe it's adding even more interest in the stroke area. So far, it seems. They're sensitive to that.